Thank you so much for taking the time. I appreciate you're really busy just to kind of chat to me. And we obviously spoke last year at Logi Pharma for the podcast, but this is a bit more kind of you guys forward. You just kind of, we pulled you along to kind of take part in the SkyCell one last year. So it's kind of nice to get a full episode in with yourself. But it'd be great if we could just kind of introduce you a bit more. I know you've been on the podcast before, but just a bit about you, how you got into the industry, all that jazz, and how you've ended up at CEVA.
Okay.
I know, so, big questions there for you to start off. Why did you choose this career path?
I stumbled into logistics, as many of us probably. No, you set up with big goals and then study at the university, and then different additional MBAs that you went through. Like, I'm going to do this and that, and then you end up in a situation where I started with DHL red and white, but that was during my studies. Yeah. And somehow I stayed there. You go into the real working world, like, but they need 5 years of experience. I'll figure that out, but I keep working here. Then one thing leads to another, right? And you stay in the logistics business. First on the red and white side, then I went to the other side to Alcoa, specialty chemicals. Pretty soon, the moment I joined there, they sold off the goose with the golden egg, the specialty chemicals part. So I had to rebuild with the team the whole supply chain. That was actually really fun.
That's quite nice.
From early morning to late evening, and then getting the opportunity to implement that. Great. After those projects, you come back into normal life. You travel the world, you do the implementation, and there's a private life in between. Okay, let's go and live closer to home. The Netherlands is not big. I'm Dutch. I lived in the Netherlands back then. Netherlands not that big, but still 2 hours one way. So I looked for something close to home, and I ended up with DHL, red and yellow back then, and completely changed. That's how I started my career in healthcare.
Amazing.
Which has a lot of similarities with the specialty chemicals.
Absolutely.
That was kind of the link there. And I started there as a contract operation manager, so responsible for everything and anything. So operations, commercial, quality. We had a fun group there, and I looked after customers who I still am in touch with. And as with anything, there's a personal life that goes through that.
Yes.
You had a couple of curveballs thrown at you, and then you make decisions based on where you want to go. And exactly. I ended up with Hellman in the Middle East, looking after the Hellman Caliper joint venture, build up basically a Western European warehouse in the middle of the desert back in the days where Dubai World Central was very small still. We built something out of a very small setup. Started when we had 5,000 square meters of healthcare warehousing, which we started to build up from a temperature control perspective, which then ultimately, when I left, I think we had 45,000 square meters.
Wow.
That was the time when building.
That's quite exciting though, to start something that small and kind of see it turned into something so big at the end of it.
Yeah, and you have the opportunity to design warehouses and incorporate what customers really want. And then in an environment which is completely different, of course, to where you were born and raised. You have to think of floor cooling, wall cooling, and kind of things to keep the medicine in the right condition. And that was also very rewarding, because you started with a group of, when we started, we had 8 people. Wow. By the time I left, there was, over 80, 90 people. But people all had the mindset that, hey, there's a patient behind this box. And then before you teach the people that over there, and they make it their own. Well, that was a big victory, so to say.
Absolutely.
But then, we made things happen in the Middle East, and I'm very thankful for the opportunity that I had there. Always fighting with competition, of course. And then competition reached out, and that's how I ended up with agility. Back in the days, that's what made the move to Switzerland possible, and we built up healthcare there. But then from a global perspective, fun company, honestly, a fun company to work for, high can-do mentality, really entrepreneurial, wanted to make things happen as well. So during COVID, there worked closely together with the wider agility group. So you had the National Aviation Services, and then the the group that worked closely together on humanitarian aid. So I could work with my brothers and sisters and make things happen. We created an entity called Global Response Aid in Dubai, dealing with anything and anything related to COVID. And that's also where I learned a lot, honestly. We built a product, or we bought a license for a product which resembles a lot to the product that Pfizer was bringing to the market back then. And then we did clinical trials. We brought that all the way to the market, to the extent that the US and Canadian military still have that in their backpack. Wow. All during COVID days. So next to my normal job as leading healthcare. But those were the really, really fun things. And that's also where you learned a lot about resilience and about actually what you see what's going on right now.
Yeah, absolutely.
So, and then, with that then being said and done, we were acquired by DHV. I was heading the global healthcare position there from a global commercial organization. And after 1.5 years, I was approached by CMA CGM, which is basically the mother company of CEVA, where I would be interested to do the same. They know what I had done in the past in the Middle East, the acquisition with DSV, and so that's how I ended up with CEVA Logistics.
It's so exciting. I love asking that question because everyone doesn't seem to just fall into a certain place. There's only so many moving parts to get you where you need to be. It's just so interesting, especially having the experience working in COVID. That must have just been completely unlike anything anyone could have imagined.
Yeah. It's like working with your hands on your back, right?
Yeah, exactly.
And still, but the beauty there as well was that everybody started to come together, work together.
Yeah. It's just time that no one else could have foreseen, but with you guys, you've always got the patient in mind. So even more so during COVID. It'd be great to hear. You guys, obviously, CEVA is a big name when it comes to Pharma. You're a regular there. We all kind of recognise the kind of importance of what you guys do. So I guess it'd be great to hear about what you guys' plans are for the year. Is there anything exciting coming up for CEVA? And then we'll get into we've got a really exciting topic to discuss later on. But yeah, just kind of a little intro to CEVA would be great. For those that don't know, I'm surprised if anyone doesn't know about what CEVA does and all that. But it'd be great to hear from you.
No, yeah, very good. No, I'm with CEVA now for close to 3 years, working on the healthcare part, global sector leader for healthcare, building the strategy. Of course, we've been very busy the last year with integrating companies that were bought, particularly Bolloré Logistics, which was a really good addition, really working together, and we brought the two teams together. So that was very interesting and very good to get to know each other. And I mean, if you look at the legacy CEVA business, it was very much contract logistics, medical devices driven. The Bolloré part brought a very entrepreneurial spirit with pharma customers and temperature control. So that combination really works well. So it also to help us to grow, build experience, and that's what we're building upon. So for 2025, we had an initiative called the RISE strategy, which is a CEVA-wide initiative, which is based on people, innovation, performance, and having the customer at heart. We defined the ambitions, particularly for healthcare. Where do we want to grow? How do we want to grow, and which products and which regions? Building on that, for 2026, we recently initiated the One Brand Limitless Reach, because CEVA being part of the CMA CGM group, there's a bigger we can work with brothers and sisters, I always say. We have means to play with, and that's building on the RISE strategy, more integrated solution and more focus on the value proposition for the different sectors that we have. And we entered 2026, not as a 3PL, as we have to say, but more like a champion who's challenging the market in that way. And that's, I think we needed last year, especially from a healthcare perspective, to come together. We put a lot of work in creating the backbone, making sure that there is a solution, that there's trust, that we can deliver. And we hope to materialize on that for the coming year. We have our CEVA for Patients program that we're rolling out. We had that from an air freight perspective. We're rolling that out also from an ocean freight perspective, more dedicated service including all the GDP requirements. In an effort to play.
Absolutely.
To play in the market and serve the customers in the best possible way.
Absolutely. And I guess to kind of, because we've kind of had a couple of chats before getting on the mic and kind of discussing what topics would be kind of important and prominent, especially for Pharma coming up, ones that we discussed there. But we were chatting about kind of collaboration across the kind of pharma ecosystem. That was kind of a big topic that came up. It'd be great to hear about how that looks today and then kind of what collaboration looks like when it's working well from kind of you, the expert.
I think of collaboration, it's an ecosystem that we work in, right? I mean, and that's constantly changing. If we look at what's happening in the world, China is coming to the forefront as the second biggest pharma market at the moment. India is changing from the pharmacy of the world for generics, but now coming up with clinical trials, biosimilars, biologics. So more and more changes there. So that also changes the supply chains that are there. We see that there's more pressure on big pharma. The patent part is coming in, and at the same time we see that from an innovation perspective there's different changes. I mean, if you look at what's happening in North America, funds are being cut to bring innovative medicine to the forefront, and in China they're expanding, so that's growing. So that whole ecosystem is kind of changing. And I think that's a constant at the moment. You need to be agile. You need to be prepared for the next thing. When we talk about Red Sea, but also about the U.S. tariffs that are popping up, that creates another regionalization. So the moment that you start building a supply chain, being a provider itself, then you need to take all those things into consideration. I think coming back to your question on the collaboration aspect, that's the only way how it works.
Yeah.
We need to work with the airlines, with the shipping lines, hand in hand with the pre-carriage and the on-carriage providers as well. We can do everything right. If one part in that chain is missing, we can do everything right, but it's still the patient in the end doesn't get the product. And I think what we learned from during COVID, you want to fly or you want to transport or you want to drive goods only if you know that they will arrive in the right condition. And we had a number of occasions, and we learned the hard way, of course, during COVID. We had everything organized. We had a plane organized to fly from India to the US. Only we forgot nobody could load the plane because people couldn't get to the airport.
Yeah.
So those are the things that you need to take
have
into consideration.
Every step of that journey, I guess. Everything needs to be accounted for, otherwise it's just not going to go.
Yeah, it's that whole it's micromanagement to a certain extent, and there are certain tools that help you with that, right? To create that visibility. Do we have the truck available? Is it actually moving? Do we have the staff available? I mean, think about customs, but also think about quality. So we often think about the main lanes, but there's much more to it that we need to take into consideration, and that ecosystem, that collaborative aspect is really, really important.
100%.
It's people business. What we did from a CEVA perspective, which was a good thing that the Bolloré organization brought in, the competence centers, where people actually map everything up front for specific customers, especially where it comes to complex routes. Map everything out, make sure that with quality everything is checked, double checked, visibility is there, and then we start to go out to the customer. It's more about the solution development. It's more about the end-to-end part. I mean, I think what we see happening in the market is that you're no longer a 3PL. You're more like an end-to-end service provider. And if that means that we need to manage other service providers, that's what we do as well. It's in the same way we do that with other service providers, where we report into them. Because that collaborative aspect that we talked about after COVID, we all understand the importance. And
100%.
from that perspective, it's also live and let live. Because in the end, you need to build resilience into your supply chain. And don't put your eggs in one basket. You wouldn't do that at home, so why would you expect that from customers? So I think that's the collaborative aspect. And for that, you need global reach. You need to have a network that really works.
100%.
And then this is an industry where it's built on trust. A lot of it is built on trust on people. And you need to live up to that expectation every day.
100%. I guess, is it the same for when you kind of picking the right partnerships as well? Because that's going to come into play, and kind of obviously managing these are quite complex, and you need to kind of have certain compliance. Patient risk is obviously a big issue. I guess you want to kind of all have the same goal in mind. That makes selecting the right partners easier because you all have the same end goal. Or is it still kind of, you've got to kind of pick the right ones, work with them, and kind of really build that relationship?
Yeah, but it's like almost like a normal relationship, right?
Yeah.
With some people you connect better than with others.
100%.
And you look at whether you're complementary to each other, but yeah, you being complementary,
Yep.
you can't be complacent. In the end, it's always that patient that you need to have in mind, and I think that's in general industry that's prevailing. People understand that, and there's different ways how to get to the end goal. We try to do that through end-to-end visibility, making sure that what we do for one customer, we can leverage for other customers to also make it more sustainable in a way. In the end, there's also a cost associated to it.
Yeah.
And there's but like I said, there's different solutions that you can have, but some customers, some partners fit better than others.
Yeah.
But then again, going back to resilience, you need to have multiple partners. At the moment that one drops the ball,
you need to jump to the other. Yeah.
Somebody can. Yeah. And that's also how we think, but it's also how customers think.
100%.
So that's where that whole ecosystem somehow comes together.
And it is like life. You're not always going to get on with everyone. That's just how things work and how things go. You kind of got to kind of have the right relationships there. I guess it's great to kind of, we've set the scene there, but it'd be great to kind of hear some kind of real life examples about kind of where you've seen this in practice, where kind of problem solving might have been kind of particularly urgent. I know that we've kind of done we've chatted about COVID, but it feels like nothing's kind of normal right now. Everything there's always ups and downs, especially for you guys in the pharma supply chain. There's always kind of some turbulent time. Have you got any kind of examples there for how you've kind of managed these multi-stakeholder situations, I guess?
Yeah. So you had a couple of examples, right? We had the Red Sea.
Yeah.
Then that's and before that we had the Suez Canal that was being blocked.
That's a
so
big
when you
one.
think everything is normal, it's not. And then of course the tariffs come in. So I think you need to be agile at any given time. Of course, we have instances where things need to happen. You need to fly things because of what happened with the Suez Canal. We had to reroute certain cargo.
That was so mad. That was such a weird period of time. That kind of that was insane.
Yeah, and then you add additional lead time, but that also means that you need to go after air freight capacity to make sure that that's being delivered, and that the customer can still meet their delivery lead times, right? I mean, there's an expiry date on those products. Yes, you ship them up by ocean, but hey, if that adds another 30 days, well, then things go quickly, right? 100%. So that's why we had to work closely together with our partners, with the shipping lines, but also with the airlines.
Yeah.
But what we also work closely together with quality to see, okay, we are now needing to change those routes, lane risk assessments, all that needs to be signed off by customers as well. So it's not like from one day to the other you can switch everything around. We're trying to be more agile there and use more real-time data, allowing us to intervene there if things happen that hey, this is your contingency plan, because we always have business continuity plans. That's what we need to drive forward, and that's where our competence centers really come into play, where they can play that role. They're connected to the operations, but they overlook and create the end-to-end visibility and spot, okay, this is where that makes sense, or hey, look into something very basic, look into that weather front, and then we see how we can remediate that. 100%. And that's where I think the industry is going more and more as well, learning from the fact that nothing is stable, everything changed. You need to be agile. Be able to work on 2-3 solutions at the same time. And I can talk about product launches that you do, and then when you need to be into the US airspace at 5 to 12, and who's first to the shelf, all of those things we know as well. But it's all about orchestrating it, right? And making sure that the air ground handler, the trucker, all are aligned.
100%. Yeah, absolutely. Is there any other kind of, I guess, like we've kind of talked about ups and downs, are there any other challenges that come in that really kind of have an impact when it comes to kind of collaboration. I know kind of technology is always changing, everyone's always looking to innovate, but these things can be quite difficult to kind of then put in place and have work, and cost is always a big one. Everyone's always trying to reduce costs. But is there any lessons you've learned kind of operating under that pressure of kind of added challenges that have kind of come from inside?
Yeah, it's always too.
It's always fun. There's always something that someone wants to change.
Yeah, but don't get caught up in the moment.
No, exactly.
Do, right? and keep the patient in mind, right?
Yeah.
The moment that you forget about the patient, you start running.
Yeah.
It's very easy to get caught in the moment. Stick to what you do best. There are certain protocols that you need to stick to. You can cut corners. Oh yes, customer, we can do that. And then in the end, oh sorry.
Oh shoot! Yeah, this isn't ideal.
Quality. Huh?
Yeah, exactly.
And do we have enough capacity in those cold rooms? It's whenever there's a higher pressure, then you need to make sure that all the different stakeholders are involved and aligned. In the moment that you start shipping, that you know that you can deliver.
Yeah, absolutely.
Rather than I always say, better to be prepared than just to be a cowboy, make everything happen, and in the end, like, oh, sorry, customer, didn't work out.
Yeah,
no.
I think that's great. I think you don't panic. Whenever I'm at Logipharma, my kind of role is to kind of chat to all you experts and hear what you're all kind of working on and what's exciting you. And I feel like the past couple of years, everyone's just wanted to jump on the AI train and kind of talk about how they could do it. They don't know what to do, and all these kind of, they get really in the moment because they've been in all these chats. But then a year later, you come back and you go, oh, it actually wasn't that big of a stress. No one needed to jump on that. It's always the same, and I love kind of going through the kind of buzzwords with them at the time and then reflecting a year later and going, wasn't that big of a moment, was it? It was just needed a second. It's always
I think AI from an R&D perspective, of course, has helped shorten lead times for products.
It's made my life so much easier. Yeah, it's made little things so much easier, but I don't think it's kind of taken anyone's job like anyone feared it would. It's just kind of enhanced. It's given you a bit more time in certain things to prioritize other things.
The human aspect is still very important.
100%,
the human interaction is key. Some need to interpret it, although you see a lot of developments where bots are coming in and you can automate a lot of things. Is that what the industry wants? Is that what the customer wants? I mean, in an ideal situation, you want to create that end-to-end visibility, and the customer wakes up, looks on his phone this morning. Okay, dear customer, only these 2 shipments might be a challenge. The rest is running smoothly. But that's the end goal. How do you get
there?
And that, I think, requires a lot of reiteration still. We've seen the progress year on year from data accuracy, data lakes coming together, more and more providers being able to provide you that end-to-end visibility, including the not being reactive but proactive, integrating more and more. But how do you distinguish between what's really working, what's not working with your own system? And if you integrate different companies, and I mean, the logistics companies are also pretty big companies. We have 110,000 employees alone. Then how do you get them all on one system, making sure that one system then also helps? I mean, we see the same happening in the healthcare market, where there's mergers and acquisitions, and what could work as a 4PL solution. You see customers more and more focusing on, okay, we need to get onto one ERP system, and then that starts to work. So it's a constant process that is ongoing. So, and AI played its part and plays its part, and I honestly see progress, and I think that end-to-end visibility, which was a nice to have, has become a must-have now. If you don't have that, then it's going to be difficult to participate. So that's also what we're working on with the CEVA for patients, to make sure that we can provide that end-to-end visibility. And it's more about the orchestration part. But AI, does play an important part.
Yeah. I mean, everyone thought it was going to, because I work in content, they were like, oh, this is going to game change. You won't have to write anything ever again. I'm like, no, it's still, I can tell when something's written by AI. It's my own pet peeve. I hate when I kind of go to write something and I'm like, oh, I'm not, it's just the same, it's spitting out the same jargon and same rhythms. It's not for me. But I guess we kind of move on. You're a regular at Logipharma. You've kind of, how many have you been at these days?
A
few.
In Switzerland, right?
Because you guys always kind of have have such a big presence there. It'd be great to hear that you guys are doing a masterclass. So it'd be great to hear a bit of kind of how you prepare for that. I know we're kind of talking circular value chains at Pharma, I believe. It'd be great to hear a bit more about your masterclass and what you guys are hoping to kind of chat about while at Logipharma.
Yeah, so we took the opportunity now. We were there early enough now to secure the masterclass. No, and the back and forth with the WBR team, very good interaction. Okay, what do you want to talk about? How can you bring something fresh and new to the table? We consider ourselves also kind of a new company.
Exactly.
We reinvent ourselves time and time again. No, the masterclass is out, and then just read out the title: Beyond Linear Supply: How to Leverage Circular Value Chains to Redefine Resilience and Responsibility in Pharma. It's more about the circular aspect, and which is something that CEVA has a good experience in other sectors. So we could potentially leverage that here. And what we see is that the linear supply chain, of course, brought the efficiency, straightforward. The circular supply chain will bring the resilience, and resilience is key, and that's how we see that as a competitive edge as well. And in the end, if you hand it over to a service provider, you want to make sure that it works. And that's what we are here to live up to as well. It addresses a couple of pain points that there are in the market. You have supply chain disruption, the waste. There's more and more waste coming into the equation. Think of your temperature controlled packaging. If it's not reusable, that piles up. Numbers are really, really high. And of course, there's a regulatory pressure and an environmental pressure to start shipping more sustainable. And that's with the circular part that will address part of that. It will reduce the dependency on virgin materials. You can start reusing those again. And what we see happening as well in the market, which you see also from what do you call that? If you have your toothbrush, you get on your phone, you get refurbished ones. So products that are not being reused to reusable packaging, to post-consumer take-back schemes. Those things is what is driving the organization as well, our customers, and that's what we can help with in that circular part. And there again, there's dependencies, there's relationships, there's partners that you need to work with. It comes back to that whole orchestration again. Absolutely. And with doing that, I think that the LSP makes itself an integral part of the supply chain of the customers. Going back to a very basic principle, stick to what you do best. The pharmaceutical companies develop products, we take care of the rest. I think that's where we try to get to. We've got a masterclass. We have a guest speaker there as well. So aiming to bring that together. And we really look forward to that. I think it's on the Wednesday during Logipharma.
Amazing. It's going to come around so quickly. I'll make sure kind of link it in the show notes and stuff like that. But it's very exciting. I'll be popping by to kind of say hi. I'll be kind of dotting about. So it sounds it'll be really good. It'll come around so quickly. But we know we can't predict the future and kind of all that jazz. But I guess with the kind of topic in mind, how do you see collaboration in pharma logistics evolving? Do you have any kind of predictions for the next, say, 5 years?
I think what you see also going on within the logistics industry, there's more and more consolidation. So companies are in a better position to provide services around the globe. You become global providers. I think that from a collaboration perspective, we need to work together. History has proven that. Before COVID, there was all about, I can do things better than you can. But in the end, if we're really true to healthcare, we all care about that patient, right? We all have nice slogans and making
nice
sure
branding and all that jazz.
But the moment that you end up in hospital, you know why that is, right? And then it doesn't matter whether that's being delivered by X, Y, or Z.
100%.
But in that whole concept, we need to make sure that the products are available and that people can survive. People live longer. There's more and more demand. Amazing to see what is possible already if you go into a hospital. But I think that's what's driving things forward. And it's not because you have blue eyes that people will trust you. No, it's more about the remit and the different services that you can deliver. And that's what, at least for CEVA, we're working very hard to make sure that we can support end to end. And there's leverage all the capabilities we have as a group, as a company, and develop that going forward. And I think if you then look at where the market is going, I think what should we look at going forward? You need to build that ecosystem, build multi-stakeholder ecosystems where we can challenge each other. We can work together and know that it's not one provider or one supplier that can deliver all. So it's creating that ecosystem, connect the supply chain ecosystem, circularity, sustainable logistics. I think that's where we're going. In the end, only fly or ship the stuff that actually will arrive in the right condition, because otherwise it is a waste of money. Digital data excellence. I think that's something that you see more and more, because if you have the data, your decision making is so much easier. And if you can pull that from one system or one data lake where you can consolidate all that, even better. But I think it's key going forward is the strong supplier and stakeholder partnership. We see that with big pharma already, where the LSPs will become an integral part of their supply chain, and it's more the partnership approach than becoming a kind of a commodity. It's easy to compete on price. In the end, we're all on the same vessels, we're on the same flight. But that partnership, and I think that's also something that we learned during the different challenges that we had. Market prices go up, market prices go down. You can also be flexible there and make sure that you work with market demand. And I always say don't mistake luck for knowledge. Make sure that it's fair. In the end, we're patient, and if prices go up, our prices go up as well. If they go down, they should go down for us as well. Absolutely. So I think that's the fair aspect. I think that's what is key in the years to come. The collaborative culture that we need to create in the end for the patient.
Yeah, that's. I mean, my last one was just going to be what should be prioritized today, but I think the kind of hint of what our conversation has been about is that everything should be kind of about prioritizing the patient and working around them. So this has been great. Thank you so much, Eric, for your time, and I'm looking forward to kind of yapping in person again this year in Vienna. It'll be really nice to catch up, and rather than just being over Teams, there's only so much you can yap about in Teams.
No, we'll catch up. We'll catch up.
Exactly. We'll catch up.
And, look forward to that.
Amazing.
Thank you for your time.
No, of course. Thank you. It's always lovely to catch up. And I'll see you soon. But any final thoughts from you or CEVA?
No, let's work on it together, and see you all in Vienna.
Lovely. Well, thank you so much.
Yeah.